Hi everyone, thanks for joining. We're going to get started now. Just a reminder, we have approximately 45 minutes and it's one question, one follow-up. Today we have Dr. Brown and Dr. Williams here, so I'll turn it over to them to get started.
Good afternoon. It's Thursday before the long weekend, so it's a good time to look at where we're at, what we need to be aware of as we look at the fair weather and partake in a safe way and the long weekend coming up. And so it's great to have Dr. Brown back with us. It's been a 3-week period to come back and to give us an update on the modeling and the data. So I'll have some comments to make afterwards. So over to you, Dr. Brown, for your update. So thank you for joining us today.
Great. Thank you, Dr. Williams. So I want to keep my opening remarks brief today. Our picture today looks different. The direction of the pandemic has turned, and if we're careful and cautious, we can maintain this momentum. And this momentum is what gets us to a good summer. That's thanks to your work. You'll see in the data today that the numbers of cases and hospitalizations are falling. That is good news. But we need to temper this good news with the knowledge that our hospitals are still under incredible strain. Hospitalizations are decreasing, but the number of people in hospital with COVID-19 has just dropped below the peak of wave 2. And we still have a very high number of patients with COVID-19 in our intensive care units, and a high proportion of these patients remain on life support. Our hospitals remain at risk, and it's our care and caution that will bring them out of this risk. Let's talk about why we see a different picture today. Our vaccine rollout has been impressive of late. We'll show you data on that, and it is helping. And the public health measures, however taxing and frustrating, have helped stop the spread. These are measures that Ontarians have supported because you made the hard decisions to meet people only outside, to keep physical distance, to wear masks, to stay home when you're sick, and, if you're an employer, either to shut your work site when people are at risk of being sick, or if it has to remain open, to operate it safely for your employees and patrons. This is what has helped turn the curve and given vaccines time to work. So the message today is simple. The more we can vaccinate and the more that we can keep spread down by sticking to the basics that prevent transmission, the faster we will see the end of the pandemic and its associated ills. The projections we'll present today are clear. We are doing better than much of the world, but we're nowhere near yet the case counts we see in countries like the United Kingdom. The models suggest that reopening on the 2nd of June will lead to a rise in cases that will likely subside later in the summer. Waiting till the middle of June to reopen will likely bring cases down to a very low level and a consistent downward trend throughout the summer. Opening schools on the 2nd, but nothing else, takes us somewhere between these two options. These are all challenging trade-offs, and none of them are without risk. I want to emphasize that these are challenging choices. No one wants a fourth wave. We as a community will need to be careful and cautious to avoid that fourth wave. And the wild card in all of this is the variants of concern. If a new variant, particularly one that doesn't respond to vaccines, enters the province from abroad or spreads widely, we may lose control. But the fewer cases we have, the better we will be able to control new variants as they emerge. So the outlook is cautiously optimistic, but this is not a time to let down our guard. As we try to control spread, please get vaccinated. In some areas, even teenagers are eligible for vaccination now. Even if you have to wait in line or wait online, please get vaccinated. Get vaccinated, help others get vaccinated, give your employees time off to get vaccinated, and remember to come back for your second dose when you're called. And bring it outside. The weather may not be as great next week as it was this week, but if you're meeting folks, please do so outside safely. We've changed the picture. Now we need to lock in those changes. So let's get to the numbers. And my apologies, the sign language translation will disappear when we come to the slides. It will return immediately afterwards. Great. We'll start as we'd usually do on our key findings. Cases, positivity, and hospitalization rates are decreasing. Control of the pandemic is improving due to current public health measures and vaccinations. These are the efforts of Ontarians that are bringing this under control. The access to care deficit continues, but high-priority surgeries are being performed at higher rates. Maintaining progress on vaccinations and maintaining some public health measures until mid-June can help ensure a good summer. School reopening will create an increase in cases, but this may be manageable. And outdoor activities are much safer than indoor activities and should be encouraged. Let me go now to the slide we usually start with, which is the case rates, weekly new cases per 100,000 residents across public health units in Ontario. For the first time, you can see that there are fewer health units with increasing case numbers than those with decreasing numbers. The majority now are decreasing, with only a couple showing substantial increases. It's important to note at this, though, when you look at this, to note the substantial regional variation in overall case rates. So case rates are down. Positivity, number of tests that come back the percent of tests that come back positive, is also down. So when we see declining cases and a declining positivity, this suggests that this is a real decline in cases. It's important to note that testing volumes are also down. So we may be missing some cases, but when you consider cases being down, positivity being down, and hospitalization rates being down, this looks like a real reduction in cases. And just following at that point about hospitalizations being down, we thought it'd be important to show hospitalization rates in the second wave compared to this, the third wave, for some of the older age groups where we've seen substantial penetration of vaccination. You can see in the oldest age group, which is the top dark purple line, that's people over the age of 90, and the orange line underneath it, which is people between the ages of 80 and 89. You've seen a sharp decrease in the hospitalization rate per 100,000 population, and a much lower peak in this second wave. And so all of this suggests that public health measures are helping control spread, but also vaccination is helping control spread of the disease. You can see here a chart that we show every time. This is the level of patients in inpatient beds in hospital, people in hospital with COVID-19, and people in intensive care units with COVID-19 or COVID-related critical illness. You can see that hospitalizations have come down substantially over the last little while, but important to note that we are now kind of back at a point that's just below where we were at the peak of the second wave. So although they've come down, they're still at a high level. You can see the intensive care unit occupancy, the number of intensive care beds that are occupied, or the percent of intensive care beds that are occupied by patients with COVID-19 has also come down, but we expect this number to come down much more slowly than we'd expect to see with the hospitalization rate. And if you look over at the second wave, you can see that same pattern of hospitalization rates coming down quickly, intensive care unit occupancy coming down much more slowly. Moving now to the projections. I want to show 3 lines here. These are just representative lines out of the 5 different models that we run to try to understand what's happening with the progress against the pandemic. Each of these models has separate scenarios or multiple scenarios that they run. But really looking at 3 lines here. In each of these lines, we've assumed that there would be a particular date for reopening. With the red line, we've assumed that we're open right now. With the yellow line, we've assumed that we'd reopen on June 2nd. And with the green line, we'd assume that we'd open on June 16th. With all of these as well, we've assumed that we're vaccinating about 130,000 people per day. And it's important to note that we're not considering new variants of concern. So it's hard to model variants that we might not know what they look like, so we can't actually model them here. But this assumes that there's nothing new entering the country. So as you can see here, by about mid-June, were we to reopen back to a level of contact that's similar to what we saw in March before the stay-at-home order, were we to reopen, cases come down to about 1,000 daily cases, but not much further. If we stayed in where we are right now with the current public health measures, it's about a 50% reduction off of that to about 500. There is a little bit of a surge with the reopening that then starts to flatten later in the summer. But if we are closed for 2 more remaining weeks, we estimate or we project that we'd actually be at a low and continually low level of cases. Were only schools to open, the line's pretty much between the yellow and the green line. Let's talk about what this means for intensive care unit occupancy. You can see, as with the last one, we tend to sit in the range there, just where we thought we'd be in terms of the modeling. What you do see is a decline in intensive care unit occupancy. I think it's important to note that these projections of intensive care unit occupancy are likely optimistic. There's lots of reasons to suspect that the decline in occupancy will be less and less steep. There's a couple of 3 reasons for this. The first is that we're seeing younger patients who tend to stay longer. We have a high proportion of patients on life support, on ventilators right now. Really, that reflects patients who are severely ill and will stay longer. And there may be repatriation of patients back into intensive care units from hospital wards who can benefit from that care. What you'll see really is that the intensive care unit occupancy does tend to decline across all scenarios. That's because we're not projecting out much farther really here than the middle of June. You'd expect, were we to see farther projections, there would be a difference between the yellow and the green line here, with the green line being lower. I want to talk now about the access to care deficit. The access to care deficit does continue to build. Instead of showing you the usual slide, though, we thought it'd be important to talk about what care is being provided. You can see here really in that red line, after the initial shock of the pandemic, the first wave last year in the spring, higher priority surgery, that's reflected by that red line, has been much more frequently performed than lower priority or lower urgency surgery. You can see while lower urgency surgery tends to be below the level that we would have seen in the previous year, higher urgency surgery tends to be above that, showing that we're prioritizing, our hospitals are prioritizing the most urgent procedures. Going on to transfers, we are still seeing a significant number of transfers, although it has come down. And were I to show you the data from today, that number has come down still, but there are still transfers as the hospitals that are most significantly affected work to cope with the pressures of the pandemic. Moving on now to vaccination. I think it's important to note there has been substantial increase in vaccination coverage across the province. As you can see, really relatively stable now, the proportion of people over the age of 80 with a vaccine, with an appointment to get vaccine, is very high. Moving to 70 to 79 as I move across the slide from left to right. 70 to 79, significant, really the majority again of patients or people in that age group have been vaccinated. And that's true as we move even towards 60 to 69 and 50 to 59. You can see that we've made progress on the 40 to 49 age group since the last briefing, and even in the under 40 age group, which is over on the far right-hand side of this chart, you can see some progress on vaccination. And as we go here, I want to point out that the hotspot strategy is working, and continued efforts are probably a key to a good summer. You can see there's a lot more green on this chart than in previous briefings. But I do want to call, which is a good sign, I do want to call out three things, though, for a particular comment. The first is in the oldest age groups, in the most hard-hit areas, so that's the upper left-hand side of this chart, the level of vaccination remains lower than in the least risky or the least hard-hit by COVID. So in the hardest-hit neighborhood, 73% of people over the age of 80 have gotten a vaccine. In the least hard hit, the lowest incidence of COVID-19 infections neighborhood, it's actually 87% who've gotten a vaccine. So 73 versus 87. What this suggests is that there's a need to change tactics and likely find ways to meet the people who are in these higher age groups where they are to provide greater access to vaccination. The second thing I want to note is that overall, you actually see higher vaccination rates now in the hardest hit communities than in the least hard hit communities, which is important because it actually really puts the vaccination where the impact of the disease is greatest and should have the greatest impact on how we control cases. The third thing I wanted to note is that you actually have got relatively high uptake of vaccines in a younger population in those hardest hit communities, suggesting that it's these approaches that have been taken so far have had a significant impact, and that it is possible to get younger and younger age groups vaccinated as we move through. Let me go now to the question of indoor and outdoor activities. Outdoor activities, particularly when we pay attention to ways to make them safer in terms of keeping physical distance or wearing a mask when you can't keep physical distance, are substantially safer. Data from a study early on in the pandemic suggested that the relative risk was about 20-fold lower in terms of infection outside. We think this is augmented substantially by kind of following what people have called the 2 out of 3 rule for outdoor activities. You either need to be outdoor and physically distanced, or you need to be outdoor and masked. And that substantially helps reduce the spread of COVID-19. But I think it's important to note that there are byproducts to avoid when engaging in outdoor activities. You don't want to travel between regions. This will increase the spread of the disease. You don't want to go to crowded places or where there's crowding. You don't want to carpool with people from outside of your household. You don't want to share overnight accommodations with people from outside of your household. Things like locker rooms and shared amenities that are indoor are higher risk. And dining indoors, dining with others, sharing food and drinks that way, again, higher risk. So it is possible, though, to have a safer set of activities outdoors. And just to provide some examples of this, although it's hard in some settings, local camping with your own household is safer, but camping in another region is not, and camping with other households is not safer. Basketball with masks is safer. Singles tennis is safer. Doubles tennis with masks is safer. But again, to note this, there are some structural things. The use of indoor facilities like change rooms or clubhouses or locker rooms do present a greater risk, and these structural items are important. That takes us back to the key findings. Cases, positivity, and hospitalization rates are improving. Control of the pandemic is improving, but this is still a time for great care and caution to really make sure that we avoid the fourth wave. The access to care deficit continues, but high priority surgeries are being performed at higher rates. Maintaining progress on vaccinations and maintaining some public health measures until mid-June can help ensure a good summer. School reopening will create an increase in cases. This may be manageable, at least in some regions. And outdoor activities are much safer than indoor activities and should be encouraged. And with that, I'll just go to the list of contributors to this week's briefing, and I'll stop there and turn it back over to Dr. Williams. Dr. Williams?
Well, thank you, Dr. Brown, and very informative, as well as that, I would say, careful optimism is a good term in there of how we're looking at things. And let's see how the numbers stack up with that as we look at today. Since last Monday, Ontario has reported an additional 5,604 cases of COVID-19. So you can still see we have substantial numbers accruing each day. Looking at the days of the week, we had 1,616 cases on Tuesday, 1,588 cases on Wednesday, and 2,400 cases today. I will put a caveat on today is that we saw a number of areas where their numbers were very low on the day or two prior and are up substantially today. My guess is that there's a data entry issue, so probably while today may actually be lower, the two numbers on the days before are probably higher. So our current 7-day average for daily COVID-19 cases is 2,131. That's down from 2,731, so down nearly 600 cases, and down from 3,369 2 weeks ago. That shows you how we are assertively, collectively, as Ontarians, in that bringing these numbers down through public measures and through vaccination. And so let's look at those, what they mean. Our provincial case rate has also decreased by 22% for the last full week of data, May 8th to May 14th, 2021. However, our rate is still high, 114.2 cases per 100,000 people. That's a lot lower than we were a few weeks ago, but that's a lot higher than we were in the midst in the dip between the second and third wave. And of course, we're nowhere near where we were last summer. So we have a ways to go, but we're moving in a good direction and we're moving at a good pace at this time. Sadly, as we're reporting, an additional 63 deaths since Monday's last report. So this pandemic, this third wave, is not without its sad consequences. 27 deaths reported today. And our condolences and sympathies go to the family members. As we continue to try to address and get not only our numbers down, we would really like these deaths to come down substantially. And I feel that with the vaccination and measures, we should be able to move on this. While Dr. Brown has pointed out that the amount is less than the second wave, we would like it even lower. So for those, our condolences to the family and family members and caregivers. Hospitalizations in ICU, and this has been an interesting one to look at. As Dr. Brown has alluded to, we have to look at how the numbers will shift and change as we go forward. Today we have 1,320 people in hospital and 721 people in ICU. That's down from where we were peaking close to 900 just a few weeks ago. But that is a lot higher than where we were when we considered we were having challenges back with 300 to 400 cases in the ICU back not so many weeks ago. And as Dr. Brown has alluded, those numbers are affected in different ways, including transfers as well as internal reallocation of patients back into the ICUs from the regular wards as hospitals are trying to structure an optimism of getting those numbers down and returning to functionality in the regular wards as well as they have through the Directive 2 being lifted and with direction from Ontario Health to do more daytime elective diagnostic procedures, and they'll give more direction in the future about any other changes there. The trends remain encouraging, but these numbers are still high. In terms of testing, we did a total of 45,406 tests. That is substantial for this time. So it shows that our testing frequency has not dropped off immensely. It is down, but not immensely. Our positivity rate is down also to 5.2%. Again, when we were in pre-wave 2, we were down into the 1 to 2% level. So we're coming down. A few weeks ago, we were at 9.8, nearly 10%. So the testing volumes are remaining steady and the percent positive coming down, which shows you that we are making substantive gains in this regard. So a week 7-day average now is 6.4%, and that's down from the previous week when we were at 7.2%. So with that, I think the words I used with Dr. Brown, and he used the same thing, we're encouraged and optimistic. But at the same time, we're cautious. Dr. Brown has noted the improvement we are seeing has been due to our public health measures and, of course, with the excellent vaccination program that has been undertaken at this time. As we see our daily case numbers, especially the rates and hospitalizations decreasing and our immunizations continue to increase, we know we're working on two edges there to bring down the numbers stalwartly in the next few weeks. To date, more than 7.5 million doses of COVID-19 vaccine have been administered in Ontario. And we're continuing to move closer to getting 60% of our adult eligible population vaccinated. We're hopeful that by the early part of June, we might even get that up to 70%. And that puts us at par with many other countries that were way ahead of us before. But this shows you the hard work of everyone who's involved in this, right from the task force members to the staff, to the pharmacies, to the primary care physicians, to the mass vaccination centers, to the community groups, to the workplace groups. Many different facets are working in all different areas to get as many people done as possible in the right focus and to ensure that people are kept informed with our COVAX system and to get their appointments when they need to get appointments, especially as Dr. Brown alluded to, that when your second dose turn comes, be ready to step up and take that. And so we're thankful for all the work that everybody is doing and are doing and will be doing in this regard. The fact is there's much demand for the vaccine, and we're heartening to see this. So our number of bookings, as we drop the age categories down to all adults now 18 plus, and as Dr. Brown has alluded to, we have also moved down in some areas to doing our teenagers, namely those 12 to 17. And so we are really encouraged with the number of people signing up for appointments, and keep doing that, keep logging in, and especially those that are waiting for their second dose. If we can do that in a more expeditious way, we will let you know and be updating you accordingly. So everyone should have an opportunity to book an appointment and get your shot. And every person immunized, remembering you're not immune right after one dose in a couple of hours. It does take you 3 to 4 to 5 weeks to build up your immunity, and so much more for the older patients who take a little bit of time as their systems are not as responsive as those in younger people. So we want to continue to adhere to the public health measures, and those are still necessary to be in place while we get the rest of the vaccines out and we get moving into second dose. And so at the outset I said this is the days before the long weekend in May. This tends to be a time when people really go outdoors, and the weather has been conducive of that. And so, as Dr. Brown's alluded to, do take it outdoors, but do so in a safe way. And there's some things that I think were very informative in the deck from Dr. Brown about what you should do to make sure those outdoor activities are still safe. And so it isn't just without any caution. There is some caution with some activities, and by doing some things, you can make some things that weren't there before more safe and really keep your numbers down and protect you, your family, and your loved ones. So be careful of those things. The travel between regions, the activities you're partaking with your household, to keep your household contacts clear, to stay around the home if you can, do your outdoor activities around the home if you can. If you're going out and a little distance, make sure you're doing it within your household or yourself and maintaining that distancing, masking, and all the protections you need to do. Because in the past, when we've had long weekends, it has been time for everybody to sort of let down their guard and get a little more casual, I should say. And we've seen then a surge afterwards. We really don't need the surge. And with these variants of concern, they don't give you much latitude. And in the past, some people younger have felt they had less concern about it. As Dr. Brown's alluding to, our ICU numbers and that are now filled with a lot more people younger and younger. And we've had some very sad stories of individuals who have been quite critically ill and some have passed away. So do not take this lightly, no matter what age you're at. So have a good long weekend. Keep safe. Keep consistent. Do what you know what to do. We are winning, Ontarians. We're bringing this down. We're doing it in two ways. You're sticking with the public health measures. You're being cautious while you do more things outside. And also we are going out and getting our vaccines. And we hope to keep that volume. We've got good volumes coming in. We're going to move steadfastly to get Ontario immunized and bring that down and working still towards having a more, quote, normal summer than we did last year. So we'll be updating you on that in the near future. So thank you for that. And now we'll open to the media for questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Lorenda Reddicup, CBC.
Hi there. Thank you both for this. Looking at this modeling, and I know you both said you're cautiously optimistic, but you mentioned the possibility of a fourth wave. What is the biggest risk?
I'll ask Dr. Brown to comment from the modeling standpoint, and then I may have a couple of comments afterwards. So over to you, Dr. Brown.
So there's a couple sort of critical risks here. First biggest risk is mixing. Dramatic increase in contact rates, which will lead to increase in transmission. That's what we saw prior to the third wave, was an increase in those contacts between people. There's always the wild card risk, though, of a new variant of concern that enters, or one of the ones that are here right now, somehow starting to spread much more rapidly. Thankfully, the numbers of, other than the B117 variant of concern, the numbers are generally low, but that'd be the other thing, is a variant of concern.
And I would add, I think, and Dr. Brown did allude to it in his presentation, the other factor is as these variants come in and they start to spread through our population, there are individuals that are more susceptible to it and the virus moves its way through those populations. The other challenge we have is that we're in a global pandemic and there's many events happening globally in other countries outside of us. And we are still having people traveling in and out directly and indirectly into Ontario. And bringing in other variants could be a possibility. So we have to keep our guard on. So that's another reason that we could have a fourth wave as well. Right now, our vaccines are proven to be effective against the ones we're seeing. We're trying to understand the 617 and asking our global community, working with them to understand that best to make sure we are prepared to offset that as a possibility. So those are the points we have. So more questions.
Follow-up?
Yeah, looking at slide 13, with the pictures there, making it pretty obvious to people, why did you want to include something like that?
We want to include something like this because we believe that pandemic fatigue is at a very high level. We know that people are outside. We do believe that outside activities can be much safer, but there's some rules around it that help ensure that they're much safer.
And I would add that what I think the main message here is that while outdoors, we're saying do it. But people say, well, if we're doing an outdoor event, how we do before and after that, we can have a party and a gathering together and be careless and not have distancing or masking. That's not the message. So this very much gives you the marks and caution you need to do while undertaking those more outdoor activities. So I think it's a very good graphic, and thank you for the table for presenting that.
Next question.
Jeff Gray, Globe and Mail.
Oh, hi, thanks. I wanted to ask a question about the graph on page 7. And I think Dr. Brown mentioned this. I just want to make sure I've got sort of the definition of partial reopening correct, are we talking about sort of what's been talked about? So maybe some outdoor activities, some retail with limits, this kind of thing, or what do we mean by partial reopening?
Sure. We've based partial reopening on the type of activity that we saw in March before the shutdown order. So that would be retail, it would be schools, it would be outdoor amenities, it would be a few other things, I believe, in that would be included in that. Dr. Williams may want to comment, but it was the March level of contact, because that's what we're really interested in modeling, that we use to build the partial reopening models.
Yeah, and I think when we talk about partial all the way along with our public health measures, we have had partial in mind, even with our old framework that we had with the color zones. Some are open more than others with different activities at different levels. So it's never just totally flip the switch, we're wide open or we're fully closed. We've always used a gradation in opening there. So that's what I think Dr. Brown was referring to in the graphic, and that's most helpful.
Follow-up?
And it looks to me, looking at the green line and the yellow line, that there's a pretty good payoff for another investment in 2 weeks before you went to a partial reopening. That it makes quite a big difference between those two lines, and it makes a difference beyond that as well. I mean, the yellow line starts to go down near the end of June, but that's a big difference between those two scenarios, right?
It is. I think the other important thing to note, though, is that the lower it gets, the easier it is to control when things like new variants enter. And so there's the payoff of lower cases, but there's also the payoff of better preparedness or capacity to respond to new variants.
Next question.
John McGrath, TVO.
Good afternoon. In terms of the falling hospitalizations for older age groups, does that then imply that if we do reopen schools and we do see that 6 to 11% increase in new daily cases, that we would, because of the lower hospitalizations and the higher rates of vaccinations, that new cases would be less likely to end in fatalities?
So short answer is yes. I mean, what you see, though, here is that every time that we've been able to vaccinate heavily within a population, you've had a payoff. And a good example is the dramatic shift in mortality in long-term care homes, or the focus on vaccinating there. So the more that we have vaccination, the more that you see the impact, the lower the impact you'll see. So more vaccination, less hospitalization, less death, less serious illness. So yes.
Follow-up? This briefing sort of overall, I think, is the last briefing we got was from the science table was it was 3 weeks ago. Things were different. The facts were different. It was a more ambivalent briefing. This one is more optimistic. I'm wondering what are some of the big changes? Obviously, like, case counts have come down, but have vaccines done more work than you thought they would 3 weeks ago? Has the stay-at-home order done more work than you thought it would? I'm just wondering if anything has changed fundamentally.
No, one of the things we do now with all of our projections is we try to put a red box where our last set of projections were. We're still very much within that box. But what I think you're seeing is, if there's cautious optimism, it's because we're actually hitting some of those expectations, that we're actually bringing cases down. I don't think anything's changed, but I do think, building off your question, it's really important to maintain the pace on vaccination, and it's really important to be careful and cautious about what we do, because the ICU the ICU occupancy still does remain very high. That's an incredible amount of pressure on our hospital system, and our projections, I would be fair to say, I think, are a little bit optimistic still on the decline in ICUs over time.
Yeah, and I would add in that, I think what you're getting at is a good point. 3 weeks ago, we were still under 40% of our vaccine coverage, well below 40%. And we only achieved that about 2 weeks ago. But remember, it takes about a good 3 weeks to start to build up substantial immunity. And now we're starting to see the value of that investment. And as we keep pushing beyond 50%, which we are getting 57, 58%, heading towards 60 and 70%, that will only accrue even more, allowing time for people's immunity to build up. And even I've talked to Ontario Health, and they're saying the people showing up at the hospitals are coming with more milder symptoms. So I think we're seeing this synergy between the public health measures, the stay-at-home order, and the vaccine, not only vaccination rates going up, but also the accrual of vaccine effect on public, and therefore the diminution of transmission as well as signs and symptoms are going to show their effects. So this is, as I said, cautiously optimistic.
Next question.
Sergio Rangio, CTV.
Hello, thank you. I wanted to ask about the Porcupine region. I'm referring to slides 3 and 4 there. You can see that the Porcupine area's case or infection rates per 100,000 are approaching at Toronto's area in terms of the number of cases that are rising, and it's particularly concerning to the health region up here. So, and meanwhile, the mayor of Timmins, which is, I believe, where most of those cases are appearing, has been asking for that city to be declared a hotspot in order to allocate more resources to sort of tackle that problem. So I'm wondering, are there any plans to declare that city a hotspot, or is there anything more from the province's side that can be done to help get that region's case counts down?
Well, thank you. And we have been watching Porcupine Health Unit and Timmins very carefully over the last week and a half, and working with the medical officer of health there, Dr. Cadden, and in conference with her to find out what else we might, and could do. We moved in case contact management assistance. We are looking at more vaccines to assist in that, and asking what other things we can do, as while they're not huge numbers that would put them up to that rate anywhere near Toronto and Peel, it is still an immense load for the local health unit as they deal with outbreaks in certain workplaces, as well as in some community, because they found that some workplaces have been impacted, but as well as in some places, and this is why a little precaution, you may be in a rural or remote area and saying, our issues are not Toronto's issues, we're aloof from this. It can change very quickly. And the behavior you exercise, it may give a sense of being casual about the whole thing, and it can come back. And the MOH, Dr. Cadden, has alluded to that, saying people had dropped their guard, if you may, and that has caused spread throughout the community. So we're hoping that all the efforts together there will quickly bring that under control and bring it back down again. And we only want to encourage the citizens of Timmins in particular, but around there, to exercise all those precautions, to listen very carefully to the directions from their medical officer of health, and to get vaccinated when the vaccine is available.
Follow-up?
Yes. Well, if you remember, Sudbury, I think about a month or so ago, was in pretty much a similar situation that the Porcupine region is, and yet their cases are in that sort of decreasing sort of range there, according to your modeling. So, is there what can, I guess, the Porcupine Health Unit learn from what Sudbury has done, or what more can they do to get those cases down? Is vaccination the answer? Can something be done in conjunction with that to curb that spike that they're experiencing right now?
Well, thank you for the example of the Sudbury and District Health Unit, Thunder Bay as well. Each one in the north. There's others in the south that have done the same thing. And I think what they're doing is to document the cases, case contact management, tell people to stick back into the public health measures, stay to your household, stay home. It's really time to hunker down in that area there, even with the warmer weather. If the warmer weather won't make you stay at home, maybe black flies will for the moment, and to keep under control on that, and to get vaccinated when you can. Their rates are pretty good. They can go up, and that's the advantage that Porcupine Health Unit has over Thunder Bay and Sudbury. They're in the midst of already partway through their vaccination program, where we had to really ramp up those ones. And you've seen the success that both Sudbury and District Health Unit and the Thunder Bay District Health Unit have been able to achieve in their respective jurisdictions. Understand they're all slightly different, and there are different areas of focus that the medical officer of health will have to address and that they are undertaking at this time.
Next question.
Cynthia Mulligan, City News.
Hi there. I was hoping we could talk further about schools, and I think that the parents of about 2 million children would anxiously like to know more information. Are you recommending that schools open in June. And when you say that could result in a 6 to 11% increase in cases, how concerned are you, and how concerned should parents be about that?
I'll ask Dr. Brown to comment in a moment about the contribution of school cases to the overall modeling here in a moment again, and maybe elucidate on that. I have been pushing for schools to open now for at least 3 to 4 weeks to get ready for it. And we've had consultation with the Ministry of Education. We have a consultation with all our medical officers of health who are seeing the numbers come down in their respective jurisdictions. Remember, we went and closed the schools because health units saw with the immense amount of community transmission that they ran into in the third wave, higher than the second wave, that they were not able to keep up with the case contact management. That was that barrier to protect schools from having intense or transmission within the schools to a large extent. They said, we cannot no longer keep up on that. So while the schools have been safe up to now, back then, they said we can't guarantee they will be because we can't keep up with the load of the case contact management as the variants of concern ravage through the various health units. Those numbers that we talked about today are coming down steadily, and they're coming back into range. Our medical officers of health understand the concerns, especially around the mental health wellness, the socialization, the developmental issues of all the children. And this is a very top priority to our medical officers of health, their school nurses, and their teams. And of course, would like to see the schools open as soon as they can be in a way that's functional, structural, and of course, we're looking at how we might utilize that as well to get our adolescents vaccinated, namely the 12 to 17-year-olds. But I'll ask Dr. Brown to comment on, again, maybe some clarification of how does school opening contribute or not contribute in any ways to our cases.
Thanks. For the same reasons Dr. Williams noted, we'd say schools should be the last thing to close and the first thing to open. Their critical role in kids' lives and in parents' lives, too, is obvious, and we've spoken about that before. What you see in 2 of our models that we're able to look at the impact of school opening, there is an increase. It really just moves that increase between the yellow and the green line. So imagine that you kept everything closed except schools until June 16th. You'd see a line emerge above it. So it does increase the cases. I think the question is really whether or not we'd be able to keep up with all of the other public health measures, including case and contact tracing, that would be required with schools open. But they really should be the first thing to open when we can open things.
Follow-up?
Thank you. So are you recommending a June 2nd opening? And what do you say to teachers? Do you have any sense of how many teachers in the province have been vaccinated? I know there are really mixed responses amongst parents, teachers, and students about whether it's safe to go back to school and health and safety concerns.
Well, that's what I said. I think there's a combination of different things we're looking at here because while we in public health are very concerned about the health of the children, the mental health of the children, the developmental issues, and of course are the parents, as are the teachers, in there, we have been working with our school nurses, with the various schools, principals, and staff in there. We know it's been a very tough year. A very hard year for everyone, including parents, including children, and including the teachers who have had to work in various models and hybrids in different areas and have had concerns as they've seen the third wave move through. And so we're trying to reassure them in that aspect. With vaccination, we know we have covered the special education staff as best we can with people coming forward, and we'd like to get that as highly covered as possible. We have at least, we've heard, over 30% of the teaching staff done. Those are all wide open to get vaccinated whenever they can. We encourage them to do so. So these are different things that we need to look at. Because it is a team effort. We've had safe schools all up till now, and we want to make sure that ensures that public health is now ready to go on that. We make sure that the vaccinations are moving, make sure the IPAC aspects are all there in place, and the parents, of course, are reassured and are satisfied for the safety and well-being of their children from COVID-19, as well as, of course, their mental health in that. So there's a number of factors that come together here, and as before, it was a team effort that we were successful before, and we want everyone to be at this and to be supportive of moving as soon as we can, and I would like it by June. Which day, I'm going to have to be in consultation with the Ministry of Education and, of course, there with their boards of education as well.
Last question.
Randall Denley, National Post.
Hi. Saskatchewan has put in place a plan for reopening is predicated on vaccination numbers, not cases. Do you recommend something different here?
We will be discussing that with announcements shortly on what our, because that was Saskatchewan's opening up model. We've looked at Quebec's opening up program, and we'll be talking about ours shortly, so we'll have some updates on that shortly.
Follow up, and this is the last question.
And you mentioned, Dr. Williams, that 70% could be hit in early June at the vaccination rate. That's often cited as a herd immunity number. It's the same number the federal government's using for a one-dose number. Why are we still going to be so cautious with 70% vaccination?
So we're looking at the, 70% means we've got 70% first dose. I'd like 70% two doses. And the whole thing was one is vaccination, one is full immunization in that. We know that we're seeing the effects of already one dose. There still can be transmission with individuals with one dose, while the opportunity or the impact of severe illness is reduced greatly. And that's where Dr. Brown was alluding to, seeing the drop in hospitalizations. And we hope to see the benefit of that, especially with 70%. And so hospitalization and death in most people with one dose is usually negligible, but still there. And because some people are in ages, do not have as robust immune system as others. At the same time, we found that some people with one dose can still harbor it in their nasopharynx and can still transmit to some extent. And we're still trying to understand that fully. And some may have even some mild symptoms. As we talked about, they're presenting sometimes to the hospitals with more milder symptoms and not requiring hospitalization. So where we're reassured with one dose, I'd like to be really reassured as we try to move through one dose and then start into our second dose program as soon as we can.
Thanks, everyone.
Thank you.